Hi there. Hello, Mr. Mayorov.
Hello.
Complications of diabetes terrify us most of all. What diabetes patients can do to prevent the onset of these complications? Or should they rely on doctors in this case?
You're right. Diabetes itself is not as dangerous as its so-called late-stage complications, affecting different body organs such as eyes, kidneys, lower extremities, and the cardiovascular system. And in case of type 1 diabetes, all these complications, all of them, depend solely, exclusively on high blood glucose levels persistent for many years. And it's not fiction. Large-scale, long-term international studies of this problem were carried out over almost 10 years, and they demonstrate that if a patient manages to maintain the blood glucose level within the target limits for many years, then they practically develop no complications. And therefore, we can conclude that if we want to maintain the glucose level within the target limit, we can't rely, as you said, on a doctor alone. The doctor won't calculate carbs for you and won't be testing your glucose level throughout the day. They can't calculate the insulin dose and so on and so forth. That is why, though all this is very relative, we can split roles between a doctor and a person with diabetes, and I reiterate, all this is very relative, so that patients themselves must bear 90%, over 90% of the responsibility. And as for the doctor, only 5 to 10% is left to them, namely general medical issues. For instance, a person must undergo screening. They should be examined for these complications to make sure they don't develop them, and so on. Yes, it's the doctor's responsibility. As for the everyday routine, it is, of course, the person's own responsibility.
There is much work to do.
Indeed, but it's not beyond one's strength. In addition to the studies I've mentioned earlier, there's one more fact confirming my idea, that is the so-called Joslin medal. Joslin was a famous American endocrinologist of the 20th century. After the discovery of insulin, he understood the revolutionary nature of this discovery. He also understood that it is not enough just to give a patient insulin to save their life, but it is equally important to teach a person with diabetes mellitus to manage the disease in order to maintain the glucose level, thus preventing the complications. Several medals were established in commemoration of Joslin. The medal awarded most of all is called Courageously Living with Diabetes for 50 Years. It has an image of a person with a torch and an inscription, Triumph for Man and Medicine. It emphasizes the responsibility of a person and a healthcare provider in managing this severe disease. But nowadays, not only 50-year medal is awarded. By the way, about 5,000 people worldwide have it. In fact, the number of such people is greater, but not all of them have their initial documents.
Are there such people in Russia?
Yes, we started to take up this question several years ago. And the Russian Diabetic Association applied to the Joslin Center. It nominated people for this medal. We have received more than 50 medals for 50 courageous years with diabetes by now. As for the other countries, there are medals for 75 courageous years with diabetes and even for 80 courageous years with diabetes. So, everything can be prevented. I mean, all complications of diabetes that used to terrify people earlier. Now, with the current potential of the insulin therapy and self-care techniques, it has become possible.
Thank you, Mr. Mayorov. Now I know that everything is in our hands.